Has your dog been diagnosed with kidney disease? These are 5 remedies which can help.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Hello, welcome back to my channel, and if you're new, welcome. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book. Kidney disease is far more common in our dogs than you think, and in fact, it's going to affect 1 out of every 10 dogs. The kidneys are critically important. They're filtering the blood. They're removing all those waste products, especially those from protein metabolism. The kidneys ensure that your dog stays properly hydrated. When it's filtering that blood, it's retaining all the positive, the good water. The kidneys are key for controlling normal acid-base balance within the blood. They can secrete hydrogen ions, for instance, to make sure the blood stays at a balanced pH. The kidneys produce the hormone renin, help to maintain normal blood pressure. They produce a hormone called erythropoietin that is critically important to help the bone marrow to produce more red blood cells. The kidneys are responsible to ensure that your dog has adequate levels of calcium. The kidneys convert vitamin D to calcitriol, and what that does, it ensures that your dog can absorb enough calcium so he has adequate calcium levels in his body. The point being here, the kidneys, they do a whole bunch of things, so much more than just filtering blood. Some of the signs you might see with a dog with kidney disease: increased drinking, increased urination. A dog that seems dehydrated. They may be lethargic. They're going to potentially have far less energy. You might see your dog just has a slightly decreased appetite. As kidney failure progresses, you're going to see much more serious clinical signs. Your dog's going to be nauseous. Likely they're vomiting. They're going to act really weak. They're going to act like they have no energy. You may look at their gums. You may see their gums being really pale. In some cases, you may lift up the lips of your dog's mouth. You might actually see ulcers. You're seeing some of these clinical signs. You're going to go see your veterinarian. They're going to do appropriate blood tests, urinalysis. They're going to come up with a diagnosis. But then what? Like, okay, are there any alternate options? Number 1, the first big principle here is fluid. You need to ensure that your dog is staying well hydrated. If they're on kibble, you can add water. It's much better if you switch to something like canned food or a good quality homemade diet. It's going to provide so much more moisture. For some of the clients I had that had dogs with CKD, I would actually showing these clients how to give fluids. This is IV fluid bag. We're giving it sub-Q. We're giving it under the skin. It's as simple as getting an IV fluid bag from your veterinarian. I've got a couple videos show you exactly how to do this. You've got the drip set, and then what you're doing is you're tenting a fold of skin in between your dog's shoulder blades. I'm not going to do it because Tula doesn't need the fluids. You're going to pop that needle, a 20 or 18 gauge needle, just underneath the skin. Then you're going to hold up that fluid. Typically, I'm giving about 100 mils per 10 pounds of body weight daily. And the sub-Q fluids, this is something that's typically reserved for dogs when they have more advanced CKD, more advanced kidney disease. And in some cases, they just need to be given it once a week. It's just enough to give them a big flush of fluids, can flush out those kidneys, flush out those kidney toxins. Your dog feels so much better. Number 2, diet. So initially with our dogs that have moderate CKD, so just early stages of kidney disease, we're looking at moderately reduced protein, but we're looking at a clean protein. A protein that's going to be especially low in phosphorus, low in sodium. The protein that qualifies for that would be chicken or turkey. We're going to avoid the meat, especially avoid the organ meats. They're really high in phosphorus. Typically, most of the foods that have fish in them, they also include fish bones. They're also going to be high in phosphorus. So a diet that includes chicken and rice, that could qualify. A diet that includes chicken or sweet potato, be a great option. Now, some of the specific remedies. Most importantly, you want to decrease the amount of phosphorus in the diet. It's now thought by many alternative veterinarians that phosphorus is the mineral that is damaging the kidneys. It's not the high protein, it's the phosphorus that's found in much of the animal proteins. One of the easiest way to decrease phosphorus in your dog's diet, add in additional calcium, such as this calcium carbonate, ground eggshell. Of this calcium here, each teaspoon, it has 1,200 milligrams. We're looking at a pretty typical dog dose of about 1/4 of a teaspoon per 20 pounds of body weight daily. You can just sprinkle this onto your dog's food. Next, consider this awesome antioxidant. This is coenzyme Q10. It's also known as CoQ10. It's one of the most abundant nutrients found within the body. It's found in virtually every cell in the body. But it's especially important for those organs, those cells that have high oxygen demands. In the kidneys, because they do so many things within your pet's body, they have a really high oxygen demand. When scientists have gone ahead and measured different cells within the body, they're finding that some of the highest levels of coenzyme Q10, it's found within the kidney cells. CoQ10 plays a big role in normal energy metabolism in terms of allowing the cell to produce energy so it can function normally. So what they're finding with some of these animal studies is when you supplement with coenzyme Q10, you make the functioning unit of the kidney cell, you make it actually work that much more effectively. Hence, you have your kidney functioning starting to improve. It's also found to be really important for dental disease. There's a high percent of CoQ10 within the gums, and really important for heart disease. And typically, that's how it's marketed for people. But if I had a dog that had kidney disease, I'd be getting them on CoQ10. Pretty typical dog doses, 1 milligram per pound once or twice daily. These are 100 milligram capsules. A 50-pound dog would be getting half of a capsule once a day. The thing I noticed though is that it comes in a liquid capsule. So it's going to be a little bit more difficult to dose a smaller dog. What I suggest is you're going to cut it in half and drizzle, about a quarter of it out. So one capsule is going to last a small dog about 4 days. The B vitamins, they're also important for many of our animals that have kidney disease. These are water-soluble vitamins. Hence, when the kidneys are not working as well, guess what happens? So much of those B vitamins, they're being excreted or lost in the urine. These B vitamins, they're critically important. They're important for your dog to have a normal appetite. They're important for normal red blood cell production. Not enough B vitamins, not enough red blood cells. And then what we're finding is many of our animals, when they're supplemented with additional B vitamins, they feel better. So it's a real inexpensive, easy remedy to give to your dog if they have CKD. Highly suggest it. This one from New Roots, it says multiple B vitamins within it. It's what I would suggest, a B vitamin complex supplement. As far as dog doses, it's about a quarter of one of these capsules per 20 pounds of body weight daily. So you just break it open, pour about a quarter of that powder onto your dog's food. An old but good remedy. Don't forget your omega-3s. This here, the omega-3 fatty acids. The omega-3 fatty acids, they're key anti-inflammatories, and they've been well documented to be beneficial for kidney disease. As kidney cells die, there's an inflammatory response. Additional cell inflammation produces free radicals, further damaging other kidney cells. The omega-3 fatty acids, they can help break up that chain, less inflammation, less kidney cell damage. One of the last long-term studies I looked at though, they really emphasized that it needed to be an animal-based essential fatty acid, i.e. salmon oil, or i.e. our supplement krill oil. They weren't seeing the same benefits from the plant-based essential fatty acids. Pretty standard dog dose, 500 to 1,000 milligrams per 50 pounds of body weight daily. The good bacteria, the probiotics, they could really help. This is our new probiotic formula, Dr. Jones's Ultimate Probiotic Formula for dogs and cats. A recent study done in 2022, it showed that probiotic supplementation with one specific probiotic, Lactobacillus casei, it resulted in a decrease in the incidence of mice getting CKD, and if they had it, it delayed the progression of CKD. In part, they think the probiotics are doing it by number one, decreasing some of the markers of inflammation, less kidney damage. But the probiotics are also altering what's happening within the gut. And if they can help potentially digest some of those protein byproducts much more effectively, i.e. urea creatinine, the waste products of protein metabolism, your dog is going to feel so much better. And I think in some cases, that's what the probiotics are doing. And our new probiotic supplement, it specifically has Lactobacillus casei in it in really high levels, potentially be beneficial for your dog at amounts of nearly 1 billion CFU. So meaning, yes, it's a great idea to get your dog on an additional probiotic supplement, such as this guy here. Last but not least, I wanted to mention the immune supportive herb, astragalus. It's widely used in Chinese medicine for an array of different things. Mostly it's known for us as having these immune supportive properties, but it's also specifically used for kidney disease. Research has seen as what astragalus can do, it can increase blood flow to the kidney. When the kidneys have more blood, guess what? The functional unit of the kidney, the nephron, it can actually work more effectively. So the remaining cells they can filter the blood better. That means you're going to have lower blood levels of urea, creatinine. Your dog's going to feel better, all because of this guy, astragalus. Standard astragala doses, about 100 milligrams per 10 pounds of body weight daily. I wanted to mention our new supplement, which has astragalus in it. This is Dr. Jones's urinary support formula for dogs. Has some great nutrients like cranberry, D-L-mannose, marshmallow, but also astragalus. This would also be a good option for our dogs that have CKD. If your dog has any of those clinical signs we talked about, the lethargy, the increased drinking, increased urination, etc., first and foremost, get them in and see your veterinarian, get the appropriate tests, rule out or determine if your dog has kidney disease. And then if they do, obviously talk to your veterinarian about the conventional options, but consider some of those alternative ones as well. Thanks so much for watching this edition of Veterinary Secrets. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.